You know, if you watch the show a lot, you remember Kylie. She's been very good during this whole pandemic of giving us some of her time. Kylie is the operations director at NDSU's Department of Public Health Center for Immunization Research and Education, which is a job, quite frankly, that got really, really busy. Let's bring her in. Kylie, good to have you coming down the road with us.
Thanks for having me today, Joel.
You know, when you signed on, when you said, let's do that, did you ever think your year was going to be this, your last year and a half were going to be like this?
No, I never thought I would be working during a global pandemic when I started my career in public health. But man, this has been quite the experience, mostly good and some crazy days.
Yeah, exactly. Well, the one thing is they needed you. We all need you. So that helps. At least when you get up in the morning, you know what you're doing is important. I want to talk a little bit about booster shots. Got a call yesterday. You know, I make this hour-long trek, and friends know my schedule. And so they'll call me on my drive at about 6 in the morning and say, hey, I got to talk to you about something. And this individual called about getting a booster shot. He said, what do you think about it? And I said, look, I'm saying the same thing that I've been saying to everyone, which is count on the science. You know, if you're in an argument with a scientist about science, you're wrong. and so I've been telling everybody that. His real concern, Kylie, was he's about my age, you know, he's a little bit older, 60, but he really didn't know if he should, which surprised me because he wanted to get in line really fast the first time. And so do you think that's out there, Kylie?
Yeah, so I think when the conversation comes to boosters, we do need to listen to the science and what the science is telling us. So about 2 weeks ago now, the FDA met to talk about boosters specifically for the Pfizer vaccine. And then last week, the CDC Advisory Committee met to talk about who should get those booster doses and really had thoughtful discussions. What did the data show us? What was missing? And what were the implications of that data? Now, the CDC recommended that anybody 65 and older and those in long-term care get vaccinated. The data is very clear. The efficacy of the vaccine wanes over time, and we're seeing a decreased efficacy not only in getting an infection with the virus that causes COVID, but hospitalization too. So certainly necessary for that group to get vaccinated. Now, if you're in that 50 to 64-year-old age group and you have underlying conditions, there is a recommendation right now for you to go and get vaccinated. We know that you are more likely to have severe disease. And those underlying conditions can vary from person to person. For one person, it might be diabetes, another, it might be obesity. And we're recommending that they go and get a COVID vaccine booster too, if they're at least 6 months out from their first primary series of Pfizer. And then we're saying, if you are somebody who's at high risk for exposure, if you're a healthcare worker, if you're a teacher, you should consider the risks versus the benefits. And if you feel like the benefits outweigh the risks, you should go and get a COVID booster for Pfizer. And then the same goes with, those who have underlying conditions that are under age 50. It's weighing those risks and those benefits. And then understanding, what is your exposure? Are you around people all day? Do you sit in an office by yourself? What are your underlying conditions and how much do they put you at risk? A great time to have a conversation with your doctor.
So
sure.
You and I both know that this is going to empower the anti-vaxxers to say that, see, now you got to go get a booster. It really wasn't that effective in the beginning. The best thing you can do is get COVID because you're healthy. And if you get COVID, it'll be a slight case of COVID, and then you've got a natural immunity to it. And so these booster shots are going to play into the individuals that are anti-vax. And, every fall, my wife, who's a nurse, says, roll up your sleeve, and I get a flu shot. Can you see a scenario where this is just the reality of COVID, that you'll need to get vaccinated and you'll need a booster shot?
That's a great question. So I think first and foremost, it's important to recognize that we give boosters for lots of vaccines. My kids are 4 and 1, and my 4-year-old has had 5 doses of DTaP because that's what we know he needs to protect him. And so boosters aren't new for the COVID vaccine, but right now the data is showing that they're necessary for some people. Now, whether or not we're going to need them every year, I think depends on a lot of things. One, how well the booster, this third dose, protects against not only disease, but also severe disease, hospitalization, and death. It could be that the third dose is all that people need. It could be that we need it every year, every 5 years. And I think part of that too is going to be how much disease is circulating in the community. And so I like to tell people we're not going to boost our way out of this pandemic. Really what it comes down to is people who haven't been vaccinated yet going to get vaccinated. We're going to give people extra protection if they've already been vaccinated, but we could make a much bigger difference if the 25% of adults went and got vaccinated that haven't been vaccinated yet in the United States.
So in the science community, Kylie, is there a lot of discussion in regards to, hey, here in the U.S., we're already starting to administer booster shots, and yet we don't have people vaccinated, that we could get vaccinated in other countries? In countries where, look, they're hoping just to get some of the vaccine. Are we doing the right thing here by not focusing on over there?
I don't think those two things are exclusive. I think that we can do both. We can give boosters here, and we can make sure that we're providing vaccines to countries that haven't yet received doses for 5 or 10 or 20% of their population. We can do both. And I can tell you those discussions that have been happening at the FDA and the CDC have been very thoughtful. Many conversations are occurring about vaccine equity, not only in the United States, but around the world. We know that as the disease continues to, ravage other countries, there's potential for other variants to emerge that could be even worse than Delta. They could be more transmissible. They could cause more severe disease. And so we do need to keep our eye on other countries, and we do need to do our best to make sure that they can get the vaccines as well, because they're, if they're not vaccinating their populations, that could eventually impact us here too.
So, Kylie, I've been asking people this question to make sure that on my radio show and on my TV show and everywhere on social media, I can answer it based upon science and experts. If someone that hasn't been vaccinated looks at me and says, you're pushing me and encouraging me to be vaccinated, when in fact it's my choice, and you who have been vaccinated carry the virus or can carry the virus as well. And so if you're just pushing me to get vaccinated because you're worried about me, it's my job to worry about me. Both you and I can spread COVID. What's your answer to an individual that would say that?
Yeah, so I think it's important to understand that vaccines work in two ways. So one, they protect the person being vaccinated, but they protect those around them, because if you can't get the disease, you can't spread it. We know that breakthrough infections even still are uncommon. And so if you're vaccinated, you're less likely to get the virus. And you likely, if you do get the virus, you likely transmit it for a shorter period of time. If you remember, maybe like 2 months ago, the CDC put out a press release saying, even vaccinated people have high loads of Delta, have high viral loads of the Delta variant, and that is true. But it's likely that if you're vaccinated, you're contagious for a shorter period of time. So maybe instead of being contagious 10 days, like an unvaccinated person, if you're vaccinated, maybe only 3 to 5 days of contagiousness. In the overall grand scheme of things, less contagiousness is going to lead to less disease. And so there is still a huge benefit to you and to those people that you're around if you're vaccinated.
It's about numbers. It's about numbers. In the little bit of time we have left, I want to talk to you about children under the age of 12. They're talking a lot about 5 to 11. Where are we at with that? When do you see that kicking in?
So Pfizer has submitted their data for 5 to 11-year-olds to the FDA. I know that that's a priority review for them. That's a population that COVID is spreading rapidly through right now, with kids being back in school. I think what we need to do is we need to let the FDA do their job, and we need to let CDC do their job. They're going to look at this clinical trial in young children, and they're going to consider not only efficacy, but is the vaccine safe? Now, the CDC does just this fantastic job of calculating risks and benefits of vaccination. For every 1 million children we would vaccinate, how many would we keep out of the hospital? And then if there are any risks associated with vaccination, they have to weigh those risks and those benefits. I'm really looking forward to that analysis that they'll do probably here before Halloween. And that will inform my decision-making for recommending that vaccine to 5 to 11-year-olds. I'm really excited to see that data. I have a lot of friends who are excited to get their kids vaccinated, but we need to let the process play out in real time.
Okay, one more for you. The individual that I was talking about earlier got Moderna, and he's going now to get the Pfizer booster. Does that work?
So the recommendation right now is to not mix and match. So we don't have a ton of data on mixing and matching. If you received the Pfizer primary series, you're eligible for a booster. If you received Moderna, hold tight, booster information is coming. It actually looks like the Moderna vaccine is performing a little bit better in terms of efficacy, months out from your vaccination. And we have a couple of theories as to why that might be. So you might not need that booster yet. And so hold off. I anticipate that we'll have some information on that here in the next couple of weeks, probably by Halloween as well, on whether or not you need a booster for Moderna. And hopefully Johnson & Johnson, we need information for those people too, and it's coming.
Okay, I lied. One more. Are we throwing away vaccine? What
was that? Are we throwing away vaccine? We certainly have some wastage from time to time. We have enough vaccine in this country where we've told healthcare providers that there's a significant benefit in opening up a vial of vaccine, even if you're going to throw the remaining doses. As soon as you open that vial, there's no preservative in it, and so it has to be used within a short period of time or it has to be discarded. We are encouraging healthcare providers, if you have somebody come in, give them that dose. It doesn't matter if you waste a few doses on the back end. It's worth giving somebody that vaccine. So we are wasting some. It's not a large amount, but yes, we are.
Well, I don't know how you can't. I really don't. Yeah. Kylie, thank you so much. I appreciate it. And thank you for bringing thought to this process.